Of new COVID-19 case numbers and hospitalization numbers continue to grow here in the Northwoods and central Wisconsin. Simply having enough tests and people to conduct those tests is once again becoming an issue. But there's a new method of testing that may help with that and that many people may prefer to the traditional nasal swab. Newswatch 12's Megan Mablock joins us now live in studio to explain. Megan?
UW Health Madison and many other healthcare providers nationwide have started to test for COVID-19 in a less invasive way. It's called a saliva test.
UW health leaders say they started looking into saliva testing after finding literature published by researchers at Yale that intrigued them.
Where they determined that the saliva test was in many respects equal and in some ways better even than the nasal swab.
Medical Director of Infection Prevention, Dr. Nasia Safdar, says saliva testing also has an unexpected benefit that can protect healthcare workers.
And the biggest thing is, when you're doing a nasal swab on someone, it often will provoke a cough. And so that is not the case with saliva. And so I think from the standpoint of the individual collecting the specimen, saliva seems to be a safer option than the nasal swab.
UW health leaders say the only downside to the saliva test is when the flu season begins and it intermingles with COVID, as it won't be as accurate as the nasal swabs.
I think for those who have symptoms, COVID is one possibility, but so will influenza be when the season comes around and other things. And you can't test for those on saliva. So it's better to get a swab for those patients.
However, the benefit to the new test is there are now 2 options that are ready and available across the nation.
Its main use seems to be for asymptomatic COVID patients, so patients who don't have symptoms where we want to rule out that they have COVID positivity.
While the saliva test is growing in popularity across the country, it is not yet available here in the Northwoods. Justin?